What I'll be doing is sort of kicking off the next part where the other speakers will be getting up as well, and we'll be talking really about essential knowledge. And it was interesting the way Russell had talked about really working with drug plans, working with payers, is really critical in understanding essential knowledge. And it really starts with, what I like to say is, how is this environment changing? We heard about it earlier, even on the social media concept, is that many years ago, many years ago, 2004, if a patient had a question, they predominantly went to their physician for help. If they had a question about drugs, they trusted their physician. The physician always prescribed the right drug. In today's environment, more often than not, and it's not just about Generation X or Z, patients go to Google. Doctors go to Google. 53% of doctors actually look up information online after a patient, and the most common medical source they go to is not the CPS, it's Wikipedia. So when a doctor says, gee, I don't know about that drug or treatment, let me go on Wikipedia and look it up. If Wikipedia is driving healthcare decisions, we need to understand what Wikipedia is saying. And patients trust Wikipedia and Dr. Google more than they trust their patients, or more than they trust their physicians. And that's actually happening even in the payer community, where we're looking around both public and private payers. They really want to know what patients are saying, and they're starting to listen very clearly. It isn't just about, having a payer on the panel or a patient on the panel of CDR. Public insurance companies are going to these things because they want to know what patients are doing. And we talked about private insurance companies, and part of an industry we never cared about several years ago. We would list a drug, they would cover a drug, life was simple. Private insurance companies are now being forced to figure out where they're spending their money, and to a lot of them, the cost of the drug, although important, is very insignificant because they cover the entire patient. If you've got a drug that gets a patient back to work, they need to know that because they carry the long-term disability costs, and those are the ones that scare them. It isn't the cost of the meds. Public healthcare system doesn't look that way, but private does, and it's a fact that we can actually start bringing that to the table. But what a lot of them are looking at is, how do we actually engage the patient? And today, most patients are really starting their patient journey, no matter what the disease state is, in an online community. They want to go on, whether it be Dr. Google or some sites, to really get an understanding of shared experiences. Who else is having these conditions? What choice of therapies do I have? Who's recommending what, and do I trust them? And rightly or wrongly, they tend to trust people more online than they trust healthcare professionals. That's something we need to be aware of. And they start looking up, information on adverse events. What does that actually mean? Can I actually tolerate that? And, for a very long time, we have an industry have said, look, we understand that because those are the kids of today. The reality is some of the more recent data out there shows that, really doesn't matter what your age group is anymore. You're looking at up to 70% of Canadians in almost every age group you can think of are going online to look up information. This has been sort of a seismic shift in the last 15 or 20 years. And, for most of us who have drugs in this industry, they tend to be older Canadians. You think, oh, they trust their doctor. That was 10 years ago. And in 10 years, how times have changed. You need to understand that all age groups are going online. All age groups are looking for information. And essential knowledge is understanding what they're looking up. If you want to do what's right for the patient, right for the healthcare system, or right for the company, you need to get down to the core of it. And I also like to say, really, the next one is, 50% of physicians go online to look up Wikipedia information. You need to understand what's on there. And it isn't just your marketing person that's doing it. You need to get everyone in the organization in line and making sure that what's out there is clear, is accurate, and that RxND and other industry associations are playing a role in that. Friends and peers are the most common source of information. It's surprising the number of times that people go to friends and peers to find out what they're on before they even talk to a healthcare professional. You need to understand, and we've done some recent research, that after friends and peers, before they see their physician, the next most common site, and this is before they see their physician about a disease state or treatment, is your company website. Do you have information out there that they can actually use and read? Peers and friends can be influenced, and they are driving the decision. It doesn't mean you should be writing stuff out there, but you need to be listening, monitoring, understanding, and getting your sales teams ready. There's been many times in our industry where we've seen a social media event take place. And from the IMS program point of view, that event occurs. be it positive or negative, within 2 weeks we begin to see NBRX, or earliest sign of NRX shares, changing. That's something we wouldn't have seen 10 years ago. Social media, what's going on in the community, is actually a precursor to your change in NRX or NBRX behavior, which is a precursor to where your budget's going to be. You need to understand that. Doesn't mean you need to be actively engaging and communicating, but you need to be aware of what's going on out there. And it's critical to get there. And I like to say, what is essential knowledge? Is in 2000, a simple thing like communications, you bought a TV. That was it. A TV was meant for viewing. A computer was meant for, keeping up with your work at home. A 13 gig hard drive was considered massive. Now you have more memory than that just on a memory stick, right? You have gig memory sticks now. 13 meg hard drive, people were buying them and they're saying, do you really need that much memory? In today's world, we look at communications. TVs are still dominant, but PVRs are what's going on. People are on computers and watching TVRs. There's smartphones. I think everyone around here has a smartphone that uses it for Google. Essential knowledge is knowing where your consumer is going and understanding how you can help meet their needs, because we will not get drugs listed in this country if we don't have patient support. That is the reality. We have elections coming up. They listen to voters. Voters are saying, I need access to health care. We need to make them part of the solution, not part of the problem. And I will turn it over to Peter. Peter?